We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, the U.S. Food and Drug Administration approved the use of remdesivir to treat coronavirus inpatients, now the first and only approved treatment for the virus in the U.S. The president received it. We know you treat your patients at Huntsville Hospital with it. How effective is it from what you've seen, and how important is this step by the FDA?
So in our patient and from the studies that we've seen, I think it have a modest benefit in treating those who have pneumonia and those who have what we call low oxygen saturation when they come to the hospital. We've definitely seen the benefit, and I think in addition to what we use steroid, these combination have shown some promise. We really, as the FDA approved this, this is a good step because there was mainly an EUA, which is the emergency use authorization. So there's a limitation of how we use it. By the FDA approving it fully, it's gonna give us more ability to use it and choices to use the drug. I think, again, it's a modest benefit. I'm hoping we'll get more and more trials for other medication that can add to it, where it's going to help us to pick and choose which would be the most appropriate for our patient.
Moderna announced it reached its target enrollment for its coronavirus vaccine trial. That's really good news. 30,000 people are now enrolled and have already received their first shot of either the vaccine or the placebo. So what does this mean for the search and the timeline of a vaccine?
So, and that's very encouraging news that they enrolled what they required of 30,000, and they said they're probably going to add more. Remember, the study with Moderna and most of the other vaccine is actually 2 shots. So it'll be interesting when this second shot going to happen, because that's how we're going to see the efficacy and safety to be maintained. But this is a very good news, because that means if most of the patient got the first shot, hopefully in about a month from now, we probably get most of them have already got the second one, so we can get more data and information. Safety and efficacy can take a little bit longer, but I think it's very good news to know that.
And just yesterday, we learned a volunteer, unfortunately, in AstraZeneca's vaccine trial in Brazil died. Researchers said there is no reason to stop the trial, leading us to believe that the death was likely not linked to the vaccine itself. Perhaps the placebo, perhaps it was just COVID-19 symptoms and illness. The company trial is on hold here in the U.S., though, still after a patient got sick. So when we look at these trials overall, what is the process when someone does get sick, and how detrimental is that to the study?
So in general, in any trial, when there's a patient have what we call adverse events, whoever is supervising as a physician, supervising that patient, and they think an adverse event, whether it's related to the vaccine or a drug or none, they immediately report that to the company who is supervising the trial, and they report it to the board. They, even if it's a severe adverse event, they need to report it within 12 or 24 hours. So that gets reported pretty fast. And when they get that information, usually whoever supervising the whole trial will decide to stop, wait, or know what the patient had. But in general, if there is what we call severe adverse event, most of the trial get to be reviewed quickly, put on hold sometime, make sure it's not related to that medicine or vaccine, and then reassess if you can start. Remember, and what I heard about the one in Brazil, they said it was related in the arm of placebo, not related to the vaccine arm. So that might be a good thing to know, because we want to know if it was a vaccine effect or is this something else that affected the patient. We're going to need to get more information, of course.
Yeah. When we look at the recent trends, one concern is another shutdown. Do you think that's likely, and what is your message to businesses who are really struggling right now to get by?
I really hope not to have a complete shutdown and lockdown. Most of the people now aware about what is COVID, how deadly it is, what basic things we can do to help. And I think what we can do is we can adjust that accordingly and make it in a way where we can reverse our work, virtual, like schools, back to face, and adjust it according how to have widespread infection. And hopefully by that, we'll be able to do it and manage it rather than complete lockdown, hopefully.
Any final thoughts, any message for the community tonight?
You know, I think we having now the FDA Approved Remdesivir, Moderna's talking about the vaccine enrollment fully. So we do have good news in the way of information coming up. It's really still, we're sticking with the basics. We need where we continue with our prevention, hoping we get more and more modality of the treatment, the vaccine get approved. So there is more hope coming up. It's just the community and everybody else need to keep up for the next few months, and hopefully we can manage this.
Good to end on a positive note. Dr. Ali Hassoun, infectious disease specialist with Huntsville Hospital.
Dr. Hassoun, as always, thank you so much. We really appreciate your time and your insight.
Thank you so much.